Which of the following hormones is secreted by the adrenal medulla in response to stress? Answers are aldosterone, epinephrine, cortisol, insulin. Hint is this hormone is also known as adrenaline and is central to the body's fight or flight response. The answer is epinephrine. Adrenaline is a catecholamine hormone that is secreted by adrenal medulla and is part of the fight or flight response. Next question. The depolarization of a cardiac muscle is primarily caused by the influx of which ion? Sodium, potassium, calcium, chloride. The hint is this is the same ion that causes depolarization in skeletal muscle and nerve cells. Answer is sodium. The rapid influx of sodium ions is the primary cause of the initial rapid repolarization phase in cardiac muscle, that is action potential. Next question. What is the primary function of the JGA, juxtaglomerular apparatus, in the kidney? Options: regulation of blood pressure, reabsorption of water, regulation of blood glucose levels, filtration of blood. The GGA is a key component of RAS system. The juxtaglomerular apparatus secretes renin, which initiates the renin-angiotensin-aldosterone system to regulate blood pressure and blood volume. Next question. Which of the following is the final product of carbohydrate digestion in the small intestine? Maltose, glucose, starch, amino acids. The hint is think about the simplest form of sugar that the body can absorb, that is glucose. Glucose, along with fructose and galactose, is the final monosaccharide unit absorbed from the small intestine after carbohydrate digestion. Next question. During the process of inspiration, the diaphragm and external intercostal muscles contract. What effect does this have on the thoracic cavity? It decreases both volume and pressure. It increases the volume and decreases the pressure. It increases both volume and pressure. It decreases the volume and increases the pressure. Remember the inverse relationship between volume and pressure, that is Boyle's law. It increases the volume and decreases the pressure. The contraction of these muscles increases the volume of the thoracic cavity, which decreases the intrapulmonary pressure and causes air to flow in. Next question. The primary auditory cortex is located in which lobe of the brain? Frontal lobe, parietal lobe, occipital lobe, temporal lobe. This lobe is located near the temples and is also involved in memory and language. The temporal lobe. Temporal lobe contains the primary auditory cortex, which processes auditory information. Next question. Which type of immunoglobulin antibody is the most abundant in the blood and is the only one that can cross the placenta? Options are IgA, IgE, IgG, IgM. This antibody provides long-term immunity and is crucial for passive immunity in the newborns. IgG. This is the most common antibody found in all body fluids and is only antibody class that capable of crossing the placenta to provide passive immunity to the fetus. What is the normal pacemaker of the heart that initiates the electrical impulses for a heartbeat? Bundle of His, AV node, Purkinje fibers, SA node. This structure is located in the right atrium and is responsible for normal heart rhythm. SA node is located in the right atrium and generates the electrical impulses at a regular rate and is a primary pacemaker of the heart. The process of breaking down glycogen into glucose is known as glycogenesis, glycolysis, glyconeogenesis, glycogenolysis. The term lysis means break down or separate. That is, glycogenolysis is the biochemical breakdown of glycogen into glucose, which is released into the bloodstream to maintain blood sugar levels. What is the main role of surfactant in the lungs? To regulate breathing rate, to improve gas exchange in the alveoli, to filter dust and debris from inhaled air, to decrease the surface tension in the alveoli. This substance is produced by type 2 alveolar cells and is crucial for preventing alveolar collapse. The surfactant reduces the surface tension of the fluid lining the alveoli, preventing them from collapsing and thereby improving the gas exchange. Thank you.